Okay, today we're gonna present about the possibility outbreak of COVID-19 in Malaysia in case of opening the national borders by Malaysia government, a systematic review approach. First, let me introduce myself. I'm Jin Jin Wei and my mate Chang Jin Fatiha Binti alias Nurul Syuhada as well. So, next move to the introduction. The first part is the problem statement. There has raised its outbreak of third wave COVID-19 in Malaysia in case of reopening the national borders by Malaysia government. As we know, there is a lot of study mentioned about the spreading ability of this new pandemics among the country to country. We start in one city, and it shows the transmission ability of this pandemic. So it's a research for us to study about the uncertainty in reopening the national borders in creating the third wave of this pandemic outbreak. Next is about the objective of study. The first objective is about the justify the timeline of COVID-19 in Malaysia. Second is about the identify the possible outbreak COVID-19 in case of reopening national borders. And third is the recommendation to again the pandemic crisis for future. That's all for me. I would like to pass to next person.
Now I would like to present about literature review. First of all, I would like to tell the meaning of COVID-19. COVID-19 is characterized as a disease caused by a novel coronavirus, whose name is severe acute respiratory syndrome coronavirus 2, which formerly known as 2019 NCOV. The first case recorded are in the city of Wuhan City, Hubei Province, China. When affected in symptomatic respiratory virus, typically become much contagious. We will expect the lower respiratory tract and present as pneumonia in people. There is an increasing body of evidence indicating that human-to-human transmission can occur during the COVID-19 asymptomatic infection cases, which is estimated to be between 2 and 10 days. Now I would like to present about the symptoms for outbreak of COVID-19 globally. The first incident of novel coronavirus was reported in Wuhan, China in late December 2019. The virus has infected approximately 5.1 million people around the world and killed more than 330,000 people. It has now extended to at least 185 states and regions worldwide in just 5 months. Now I would like to pass this presentation to the next presenter.
I would like to present about the outbreak of COVID-19 at mainland China. To prevent the outbreak transmission of COVID-19, the China government is adopting the direct guideline which is closed national border. The estimated median number of travel-free infection for mainland China, except Wuhan, was 7,474 cases on 22 January 2020. The overwhelming majority of infection was occurred in Wuhan. To eliminate the impact of women travel ban, China authorities facing pressure over the cases and had imposed long-period travel restrictions starting on 23 January. Solution in dealing the previous pandemic crisis. Pandemic and crisis that suffering by human beings since many centuries ago. It will discussion the solution to overcome the previous pandemic crisis. Tracking is one of the way to monitor the outbreak of pandemic. Crisis response plan required to be addressed in order to prevent the outbreak of pandemic. Post-pandemic preparedness is another way to solving the pandemic in future. I would like to pass the presenter to the next presenter.
Okay, next I would like to present about the method of study of methodology, and the method that we use is about the systematic review, and this method is introducing to study about the medical issue, and we did review on the several articles including the Orthopedic Journal, Journal of Internal Medicine, report that related with COVID-19 positive case such as the report of WHO, and New England Journal of Medicine. And they have the 7 journal articles that we have reviewed, and the data that we obtained is about the secondary data. That's all for method. Next, I would like to move to the finding.
Now I will present the finding 1. The figure 2 shows that the positive case confirmed higher than the recovering case as of 16 April throughout the MCO period. The positive case confirmed increased sharply and became 6,002 cases on 30 April. As of 23 May, there are more than 7,000 confirmed cases of COVID-19 with 115 related deaths. Although the government has restricted the people movement, but the range of symptoms of the COVID-19 diseases has spreading around. Next, according to the Assembly 2020 Figure 3 display the predicted result of recovery curve based on normal distribution. It is expected that active cases would hit its peak in the median of April. The active case may terminate before end of May, subject to full compliance with the MCO. That's all for me. Let us go to the next part.
Possibility of outbreak COVID-19 in cases of opening national border. As of December 2019, the Chinese Office of the World Health Organization (WHO) heard the first reported cases about the cases in Wuhan, a city in eastern China with more than 11 million population. The virus that causes viral phenomena in affected people, and COVID-19 is a newly discovered coronavirus infection disease or known as severe acute respiratory syndrome. Wuhan travel ban. The approximate average number of patients with no travel restriction from mainland China on 22 January 2020 was 7,474 cases excluding Wuhan. Figure 4 show the impact of Wuhan travel ban on COVID-19 epidemic. Figure 5 show the impact of Wuhan travel ban on the incidence of COVID-19 in the mainland China. Figure 8 shows the effect of travel restriction towards the mobility of people across Europe. Beginning in early February 2020, 95 airline companies have cancelled or restricted flights to mainland China and many countries, including the United States, Russia, Australia, and Italy. Those countries have implemented government-issued travel restrictions. That's all from me. Let's move to the next presenter.
Okay, next is about the recommendation to against the pandemic crisis for future. First recommendation is about the telemedicine. And we said we can figure out that the research shows is an effective way in dealing with shortage of healthcare system in handling the pandemic such as the COVID-19, and this emphasis in social distancing between the patient and doctor. It's not only deal with the COVID-19 infected patient, but it can cover the other non-emergency diseases. Second is about the fair allocation in healthcare equipment, and we can know that the scarcity of health-related equipment is facing when dealing with COVID-19, and effective or usage of capacity resources could save more people and more effective. And priority should be given to critical case, frontline workers, and researchers in future pandemic crisis. Thus, if about the effective crisis response plan, and we know that it could help in prevent the local transmission in earlier outbreak of pandemics. And a good example is about the Singapore, where it's conducting the crisis response plan in earlier state or outbreak, and success in handle the local transmission by some approach such as the controlling about the national border.
Next, I would like to present about discussion. Malaysia is a country that suffered an outbreak of COVID-19 since February 2020. We saw that the epidemic had already spread to other cities within Malaysia. Firstly, I would like to present about the discussion for timeline of COVID-19 in Malaysia. According to Figure 1, as of May, the case per day was decreasing significantly from 142 cases on 2 April 2020 to 47 cases per day. It should be the significance of movement control order (MCO) and TMCO in preventing the outbreak of COVID-19 among community and imported cases as well. Then I would like to present about the discussion for possibility of outbreak COVID-19 in case of opening national border. According to Figure 2, Malaysia facing the continuously increasing on COVID-19 case from March until May. The cases have been increasing from 55 positive cases to 7,059 cases, while the total number of patients who have recovered from the virus is 5,796 cases on 21 May 2020. It shows the ability to address a crisis objectively is spreading among the community in Malaysia. The Figure 2 also shows the effectiveness of MCO and TMCO in preventing the spread of COVID-19 in Malaysia, as MCO and TMCO have been flattening the confirmed case and successfully increased the daily recovery pattern. It supported by the decreasing case per daily, which shown by the Figure 1, especially from April to May. And lastly, I would like to present about the discussion for recommendation to against the future pandemic crisis. After facing this pandemic, some recommendations suggest in order to face the future pandemic crisis include the recommendation to apply a safety social distance in order to reduce the possibility of infected pandemic. Apart from that, fair allocation also suggests in order to give the priority to those who are riskier or seriously as well as frontline workers for preventing the future spreading of.
The last part is conclusion. There an urgent need now to return to business as usual, reopening the border when the pandemic over with the magnitude of the COVID-19 pandemic. This is because restricted control order is important to help reduce the total number of people infected with COVID-19 and to ensure the people health facility can cope at any given time. That's all for us. Thank you. Last, we want to say thank you to Sir Rasman give us an opportunity for present our research paper.